Morning, everybody. My name's Kathy Lee, and I'm Senior Officer in the Children and Young People's team. I have been having a lot of problems. I'm going to turn my camera off. I'll turn it back on when the questions come, but just to reduce the risk of any further problems with Teams. So I'm going to turn my camera off. There we go. So, Healthy Start measure, the Birmingham Measurement Tools webinar. First slide, please. Some of you may have attended some of the earlier toolkit webinars, so we'll be familiar with the first few slides. But for those who are attending for the first time, I'll go through each slide and explain the reason for these webinars. The toolkit was designed to help standardise impact and outcome measurements, which should be a key part to any intervention. Measuring the impact of what we do helps us demonstrate what we are doing is making a difference. They help us demonstrate that an intervention is having an impact in a measurable way rather than using just stories. Using standard tools allows us to compare different intervention impact, combining these standard measures with standard questions on people's identity, helps us understand if different interventions are more effective for different groups. We can also combine them with information on the cost of an intervention and the numbers of users to look at the cost effectiveness. Without clear impact and outcome measurements, it's difficult to support funding for interventions or justify that the approach used should be continued or scaled up. Next slide, please. The Birmingham Public Health Measurement Tool has been developed to standardise impact and outcome measures for interventions that are trying to improve health and wellbeing across Birmingham. The toolkit supports organisations when they are developing projects to build the appropriate measures into their service design. It provides clarity and transparency on how to clearly assess and measure interventions based on their focus, which can then be demonstrated clearly when applying for funding. It allows for accurate and meaningful comparisons between different programmes and interventions to help inform decision making. Next slide, please. The Toolbox is developing a set of resources to support measurement related to different areas of health and wellbeing, and these are included in the list down below. And today I will be talking about the Healthy Start Toolkit. Next slide, please. Just to double check, you can still hear me, can you?
Yeah, we can hear you.
Yeah, excellent. Okay, right, next slide, please. So what is Healthy Start? Healthy Start is a national scheme that supports pregnant women and families. We know that households with children and lower income face a higher inflationary burden as they spend a higher proportion of their spending on food. These cost measures are likely to make healthy eating more difficult and can exacerbate existing inequalities in diet quality. Financial support for food spending is through the NHS Healthy Start scheme. The scheme provides weekly payments of £4.25 per week per eligible individual, which doubles for infants under 1 year. This payment is used for spending on fresh, frozen or tinned fruit, vegetables, pulses, cow's milk or instant formula, as well as receiving free multivitamins. You qualify for Healthy Start if you are more than 10 weeks pregnant or have a child under 4 and receive benefits. Further details on the eligibility can be found on the Healthy Start website, or you could use an online eligibility checker. I've put a link at the end of the presentation if anybody should want to use this link. Next slide, please. So why do we need Healthy Start? 1 in 2 children in Birmingham are living in poverty. And over the last few years, we have seen an increase in the number of people becoming eligible for Healthy Start, which may well continue to rise due to the current situation. Birmingham has an eligible population of over 16,000 people who are eligible for Healthy Start. And we have 78% of families have currently registered, which is good. And we are pleased, with that increase. However, this still means that we have around 4,000 families who are still not registering. And therefore, we still have a lot of work to do. If we were to calculate the cost of unclaimed payments, we could use the average weekly payment of £6.34, which is a figure that's given to us by the Department of Health and Social Security. And then we're to multiply the number of eligible households not claiming and then times by 52. This would give us a figure over £1 million. So that means that Birmingham citizens have unclaimed over £1 million, have left unclaimed over £1 million in the last 12 months. And this is something we want to try and rectify. Next slide, please. This is just a very sort of quick flow chart on the process. It just shows the process of applying and receiving Healthy Start to the point where you receive your card. And it's just to say that the card is like many other credit cards. You can check your balance on an ATM, and you can use the card in any retailer that sells food and accepts MasterCard. However, the one difference is you can't use this card for online shopping. Next slide, please. Another part of Healthy Start is Healthy Start vitamins. And Birmingham approaches this slightly different. We need good nutrition in pregnancy and in early childhood, as this leads to better health. But it's difficult to get all the nutrients you need, even if you eat a healthy, balanced diet. Healthy Start vitamins help ensure families have what they need for healthy development. The vitamins recommended by the Department of Health contain the appropriate amount of vitamins A, C, and D for young children, and folic acid and vitamins for pregnant women and breastfeeding women. And unlike the national scheme, Birmingham provides Healthy Start vitamins for all pregnant women and breastfeeding mothers up to the first year of their child's age, and all children under the age of 4 will be eligible for Healthy Start vitamins, regardless of their income. And to help families gain access to the vitamins, we've developed a postcode checker for families and professionals to use. And by entering their postcode in, they can find the nearest vitamin distributor within a 5-mile radius. Next slide, please. So what is the tool aiming to measure? The tool can be used to measure families' understanding of the Healthy Start scheme. And by asking questions such as, are families aware of Healthy Start? Do they know if they are eligible? If they are eligible, have they registered? And if not, why not? Do families need support in the registration process? Do families know where they can use their Healthy Start prepayment card? Next slide, please. So this measurement tool is, as I say, asking the following questions. So, and with, do they know about Healthy Start scheme? A yes, no, or unsure. Are they eligible? Yes or no. If they are eligible, if they're registered, yes or no. And if they've not registered, and this is really important, why not? Why haven't they registered? What are the barriers? What are the issues? And the target population would be all pregnant women and families. And that includes the partners of women, because more often than not, partners are the ones who complete the application forms. So we do need to make sure that partners are aware of Healthy Start. The frequency is every contact you make with pregnant women and families. Just continue to raise that awareness, and our overall ambition is increasing awareness and supporting families in the process of registering for Healthy Start. Next slide, please. So by using the tool, you will be making every conversation count. Ask these questions at any appropriate contact point with families. You are the heart of the community, and you can help families gain trust in the scheme and try and alleviate any concerns that they have. You can also reassure families this is not a handout, but it's a right, and reframe the word benefits as a top-up. And also establish if there are any IT or language issues, and if there are, be able to support them or direct them to additional support where that support can be offered. Next slide, please. And specific risks we need to consider digital poverty. There's also a lack of literacy and also digital skills. These are areas you may be able to support, but if not, these are areas that maybe you will be able to signpost families to where they can receive that support. There still is confusion over eligibility, and if you're unsure, then families are unsure, then signpost them to the eligibility checker on the Healthy Start or the Healthy Start website. And those links are in one of the slides at the end. Language communication barriers. Advise and signpost families, if needed, to an interpreter service where they can get access to an interpreter to support the application process. And that telephone number is at the end, but that's 0300 330 7010. Then we have misconceptions on receiving benefits. Some families are concerned where information might go. They have a fear that the information they give will go into the wrong hands. The information is not shared, and GDPR rules apply. Or some families will be concerned that by claiming Healthy Start, it's going to affect other benefits. No, it doesn't. It doesn't affect any other benefit. We also have inconsistent messaging. Some families are receiving conflicting information. For example, some families have mentioned that you need a midwife to sign the form. This is not correct. That is no longer applies. So your understanding of Healthy Start reassures them in their understanding of Healthy Start. Next slide, please. So we had a case study, and what we did is we identified an area where Healthy Start uptake was low. We approached local nurseries to help support families by using these toolkit questions. The nurseries identified that there was a lack of knowledge of the scheme and the registration process with both the nursery staff and families. As a result, they received Healthy Start training and discussed how they could support families to register. Nursery staff felt that after this training, they felt more confident talking about Healthy Start, and families responded with saying they were having difficulty in accessing the vitamins, either because of location or the time issues, or sort of having more than one child to sort of go from one site to another. So as a result, many of the nurseries felt they were in a good position to support their families by becoming a Healthy Start distribution site. And it was a very simple process, and they were able to issue Healthy Start vitamins to their families. Next slide, please. And these are just some resources that I thought might find helpful. You've got the Healthy Start website, the eligibility checker. There's the phone number for queries. There's the translation support, frequently asked questions, and this is the link to the Healthy Start vitamins distributors. And that is the end. Any questions?